This is the Bartholomew Town Podcast.
Ladies and gentlemen, welcome into another edition of the Bartholomew Town Podcast. I'm your host, Bill Bartholomew. Today, a conversation with the director of the Rhode Island Department of Labor and Training, Scott Jensen. All right, first of all, great to be back here with everybody. I was off on Friday, and, I wasn't off. I was on the radio. We didn't put a new podcast episode out, but we'll have a few more weeks of new episodes here in December before we get into our best of 2020. Can you believe it? We're already approaching the end of this maniacal year. But in the meantime, obviously, here in Rhode Island, I just got the message on my phone as I'm recording that hospitals evidently are at capacity, and we're entering into the Rhode Island pause today, which is a 2-week semi-shutdown, okay? And you've heard me here on the podcast, you've heard me other places on social media, radio, whatever, saying that, look, I think that this pause should be far more encompassing, that frontline workers in retail, in restaurant spaces, whatever, should essentially be paid to stay home. And businesses should be able to depend on resources to get them through this as well. And you've also heard me say, look, they're saying it's a 2-week pause. I hardly believe that after 2 weeks, we're going to be able to get the COVID numbers here in Rhode Island down to a point where, we can legitimately or practically open up to anything close to full capacity again, right? I mean, that's kind of a given. I personally think that we're going to extend through the holidays and far into the winter as we get into 2021. So with that, one of the pressing issues is getting workers unemployment, TDI, whatever it is that they're entitled to, so that they can bridge this moment, pay their rent, pay their expenses, and by and large just survive through this, essentially this nightmare that we're in at this specific point in time. As we see the map of COVID cases in the U.S., we see Rhode Island a dark shade of red. We're not in a good place here in the Ocean State, and it's extremely important that folks do what they can to protect themselves, to protect their families, the people they care about, and to protect their communities. And a big part of that is receiving unemployment. Now, I've heard from a lot of you, and on today's episode with the director of the DLT, Scott Jensen, I'm going to read and ask some of the questions that you all sent me over the last few days, and I did get a lot of them. I think we get to 5 or 6 questions here in the episode, and hopefully through this conversation, it sort of sets a tone and you're able to feel a bit more comfortable about where things stand in terms of the infrastructure of calling and getting a hold of the Department of Labor and Training, applying for benefits, retroactive payments, all of these things. So I know that this is a major issue for a ton of you out there. And believe me, I completely understand it. And I think that we need to be focused on delivering to our frontline workers of any stripe hazard pay, okay? And the utmost respect that we can pay, which is to stay the hell away from as many places as possible. But we're not in a full shutdown, okay? They're still letting some indoor dining happen here. And look, I'm a restaurant supporter. There's no doubt about it. I think there's major problems with the way that restaurant workers are compensated. But I think restaurants are fundamentally a great thing for our state. And we need to kind of come out of this pandemic with some new ideas and new ways to compensate and take care of everyone. I think that's a given as well. But right now, here in this exact moment, there are people who are going to be in places of employment, and we need to do what we can to stay home and allow them to have as little contact with other folks as possible. I think that is something that we can all do if we're not out there in the field. Obviously, we're not, as individuals, going to be able to write hazard pay checks. But today's conversation focusing on you out there or someone you know who, whether you're currently on unemployment or as a result of the pause, you're going to be going on unemployment or temporary disability insurance because you've had a close contact with someone who is COVID positive, whatever the case may be, there's been a lot of confusion. And I've heard, again, from a lot of you out there that have said, look, I've tried calling over and over again. I've never been able to get through. So Director Jensen today laying out exactly what steps have been taken since the spring, where they're at now inside the DLT as far as processing claims, and where they are in terms of preparing for what I believe will be a significant continuation of this pause, as I just mentioned, into 2021. So appreciate everyone who has contributed questions to this episode and in general has reached out. You can always get a hold of me anytime, bill@ripodcast.com. on Twitter at Bill Bartholomew, also on Instagram at Bill Bartholomew, or join the B-Town Facebook group. Simply head to btown.stream. And if you want, send me a message and I'll give you my Signal number as well so we can communicate in an encrypted form if that's something that you would prefer as well. Okay, B-Town is a listener-supported program. There's a few ways you can support this operation. One, you can share this episode on social media or via text message to a friend, particularly this one, someone who may need to get this information. You can also leave a rating and review wherever you're listening right now, whether it's Apple Podcasts, Spotify, iHeart, whatever it may be. And if you want to go a step further, for as little as $3 per month, you can support the independent journalism, opinion, analysis, and entertainment that we've become known for. Simply head to patreon.com/BartholomewTown or click the support link wherever you're listening right now. For $10 per month, you'll receive exclusive monthly content, including commentary from myself and from others like Ted Nisi of WPRI, Ian Donis of the Publix Radio, Dr. Luis Daniel Munoz. It's all right there for you as a B-Town insider at the $10 per month level. Okay, let's get into this important episode with the director of the DLT, Scott Jensen. This is the Bartholomew Town Podcast, Rhode Island's podcast of record. It is a timely conversation here, of course, because of the governor's announcement that during the pause, recipients of unemployment will get $200 per week extra. And of course, December 1st, even January 1st is approaching rapidly for many folks. I guess, right out of the gate, there's been a lot of people who are either they're unable to get through on the phone lines that I've heard from, or they're just in one way or another with unemployment, with TDI, concerned that they're not going to be able to get the funds that they're entitled to during the pause or even retroactively. They're concerned about being able to stay in their homes, whatever it may be. So I guess right out of the gate, what's your message about the system that's been built and what people can expect as far as getting access to unemployment or other programs that are under your auspices?
Sure. Well, I can commit to saying that everybody is going to get what they're entitled to for sure. And, I think there's a range of circumstances where most of the people are being served at this point pretty, it's a conveyor belt at this point. Every now and again, there are weird circumstances that people genuinely have. Maybe we have to get military wages or wages from out of state, or their employer disputes whether or not they deserve the benefit. Those instances, things are going to take a little bit longer, but most of the people are going to get served pretty quickly. The governor designed the program such that it would be expeditious. So I'm confident that we're going to be able to get most of the people what they need pretty quickly.
Do you have the call staffers that you need? Do you have the personnel to process and frankly answer the phone when people call at this point?
Yeah, we do. And, I think people, just in terms of the mechanics of given unemployment insurance benefits during a pandemic, think broadly of it, like 250,000 people applied for UI benefits at one time, March, April. And that's never happened before. So we had to we had very few people, historically low number of employees at the DLT in the UI division at that point, because the rate was so good. We forget, how few people were on unemployment insurance back before the pandemic. So what we had to do was take people off of the phones and when people were applying on the internet, do all the paperwork behind the scenes to get those people the benefits they needed. And as that giant group made its way through, they get initially processed, and then many of them need to have their claim serviced. Straightforward, practical things like, I forgot my password and I got to call, I'm confused and I got to call in and get it. So unfortunately, that kind of help, you need a real UI pro to be able to make those decisions. So what we had to do was surge people away from back office work and put them on the phones and, make sure that we keep that balance. so that new claimants can get served within 14 days, and we can help people. So right now we're taking 1,000 calls a day, which because of new technology that we put in during the pandemic, we can actually know how many people are calling us. Believe it or not, we couldn't tell that, in March. Just didn't have the technology. Now we do. So that seems to be right-sized, and that's not to diminish any challenges that anybody has. It is tough to get through. We're always gonna. It's tough to get through during regular times, but we'll be able to serve people, I think, during the pause.
Do you feel confident? Because look, there's obviously, we're hoping that the pause gets the numbers dialed in. I literally just as we were beginning this got I got an alert on my phone that says hospitals are at capacity right now. So we assume the field hospitals are going to open and so on and so forth. But the pause being 2 weeks, maybe that'll work. But I'm sure that there's at least a good chance that sort of mechanic will be extended, whether it's a full-scale lockdown or whatever it may be, that we're going to be looking at through the winter, on and off again, or maybe straight through high unemployment. Do you feel like you're ready for another surge, if you will, the second wave of what we had in March and April, where hundreds of thousands of people were trying to access the system?
Yeah, I think we are. I mean, again, we ramped up hiring. There are well over 150 people working at UI right now. There were under 100 at the beginning of the pandemic, back in March. And we've made a lot of improvements. So that will help claims go through quicker. Our team is used to the incredible claims volumes. We're not going to be surprised by that. So I think we're going to be able to get through the pause and subsequent trouble. And I am one thing that is great about working for Governor Raimondo and working with Nicole Alexander Scott and her team. I have a lot of faith in the decisions that they made. So I think the pause is one of the more responsible moves when you look at how other states are dealing with this surge in claims, this surge in, you can tell where my mind is at.
Yeah.
But this surge in cases. And, I'm really hopeful that we once again did the right thing at the right time and in the right way, and that it will pay off for the state, both from a health perspective, but also from secondarily an economic and unemployment insurance claims perspective.
Are you seeing any business sectors in particular having a greater flood than others? Obviously with the service industry, with restaurants down to 1/3 indoor dining capacity, that may even drop off to as low as 0% indoor dining capacity. You would expect to see a lot of people who, frankly, a lot of their wages are earned off the books. Is that something that's kind of factoring into the challenges you're facing?
So, we're in a wait and see mode right now. Since, in the last week, claims have ticked up. That's for sure. They have around the country, but we haven't seen kind of going back to levels that we were at, in March and April. So just for a little bit of scale, week before last, we had 71,000 people in Rhode Island certifying for unemployment insurance. At a high, I think we're at almost 150,000 people. So we'd have to double again to get back to where we were during the very teeth of the early spring. So, we're watching that carefully. We haven't seen that kind of return to volume yet. I would be speculating if I said definitively, well, here's what industries people are coming from. I'm with you. Obviously, the hospitality and restaurant industry, that's what everybody's super worried about simply because of the restrictions directly affecting folks in that industry. So, we're ready to help everybody and are really keeping our eye on it.
And this applies to TDI as well.
Yeah. And luckily TDI, we haven't seen the spikes yet. It is really important for people to know that the governor's emergency order giving 2 weeks of TDI without a doctor's note, in an expedited fashion, for them to make use of if they are required to quarantine, if they need to stay at home. Those things are really important because obviously health trumps everything when it comes to what the priorities are. So if you're sick, if a family member or someone you've had contact with is sick, stay home, call us. We will get you TDI. We'll help you in any way we can. But public health is the most important thing. We just have to always remember that.
Discover over 200 episodes of Rhode Island's podcast of record, the Bartholomew Town Podcast, on Spotify, Apple, or wherever you get your pods. Or head over to our website, ripodcast.com. Folks, we are just a few weeks away from our best of 2020 episodes. We're going to highlight the top 20 episodes of the year. If you'd like to vote on what was your favorite episode or what you think was the most important episode of the year, send a message to bill@ripodcast.com, definitely including the listener poll, if you will, into my decision-making process. I'll also look at some of the total numbers that came up as we look at total downloads, total streams, all that kind of business, total shares, and sort of the impact that some episodes had as well. But that's the best of 2020, the top 20 of 2020. That's a lot of 20s there. Sorry. bill@ripodcast.com, or tweet at me, @BillBartholomew, if you want to get in on that conversation. What about for you and the people in your office? This must have been, at times, it kind of reminds me of the poll workers, you know what I mean? Where you've got maniacs screaming at poll workers in Pennsylvania, whatever it is. I'm sure you're not getting death threats like those folks, but maybe you are. But I mean, this must have been a stressful period for you. How's your office managing this workload and kind of the pressure that has been put upon your shoulders here?
Well, so in March and April, I would tell you that I have never experienced anything like that.
Mm-hmm.
I'm so proud to have served with the team of people at DLT to get all that work done. And it was hopefully something that's once in a lifetime, and I'll never forget it. And, in terms of going forward, we're cautiously confident because, we had to do some things during the pandemic that are now done. So, for example, we went to the cloud and, can take an infinite amount of phone calls to certify automatically. During when the governor closed the economy in March, we could only take 5,000 phone calls at one time from folks who needed to certify for UI benefits. That's it. We now consistently have on Sundays 70,000 people calling us to say that they're still unemployed and that they still need benefits. We did not have a remote call center on March 9th. While we were serving all these people, we had to figure out how to get everybody a laptop. We had to figure out the technology for them to work at home and hammer out the security, and get everybody at home. Folks were very nervous. Like they felt like having a laptop was, being the first one to work remotely would save their lives. And our team was really scared about it. But we've worked through that, and our whole call center is completely remote. We've trained people remotely now. They're all working from home. And by the way, we're seeing productivity increase from our UI colleagues taking calls at their house in a secure way. So there are some advantages we have right now, but boy, oh boy, was that pandemic was a scarring experience from just the amount of stress that everybody dealt with. But in that sense, the team at UI and here at DLT was like everybody else. It was a awful time, and we're in a better spot, I think, to keep to get through it now with the pause.
Last couple of minutes here, we've got some listener questions. Michelle is wondering what's going on with the fraud that we saw. I know this was not just a Rhode Island thing, but that came up. A lot of people had their claims frozen. Is that sort of figured out now, at least on a baseline level?
Figured out is a strong way to put it, but certainly normalized. So that was another, thanks for reminding me about that, Bill, because that was a terrible part of the story during the pandemic. We had never been, any UI program in the country, it had never been hit like that with that amount of fraud. We have really deployed some pretty sophisticated cybersecurity efforts to stop that, and are doing far, far better. The state police, working in conjunction with federal authorities, have actually made some arrests. We're really beginning to deal with that in a much more effective way than we ever have. So we're, just for some scale, we've delivered about $2.25 billion worth of unemployment insurance benefits since the beginning of the pandemic. Roughly $17 million in fraudulent claims have been identified. That is it's a giant number, but two good things about it relative to the size of how many benefits we've given out. It puts it in some proportion that it took a lot of hard work to get down to that, and that number has not been going up as much as it has been in the last in the last month. It hasn't been going up as much as it was going up during earlier parts of the pandemic. So we're getting better.
Ian writes that as a healthcare worker, he is finding essential workers who are symptomatic and awaiting test results that are trying to get on TDI or unemployment. He says he's got multiple coworkers who have been exposed to patients, and there doesn't seem to be a consensus on whether or not these individuals are covered by either TDI or unemployment. Where should they be going, basically, if they need to be sit out for 3 to 6 days as they await test results because they came into contact with a COVID positive patient?
Sure. Either one, but I would go TDI is the most straightforward way, and we can move that quickly. And they should definitely stay home, obviously. But TDI would be the one for 3-6 day while you're waiting to get test results back, figure out what's going on.
Twitter user writes that their employer is one of the larger employers in the state, and that they've been encouraged to take sick days if they are symptomatic, asymptomatic, or had a possible contact with a COVID positive person, rather than go on TDI. Is that appropriate, or should that person be going on TDI rather than using their sick time?
I would use sick time first and TDI second. But again, that's going to be up to the individual. We want to make sure that the TDI trust fund is as healthy as possible. And, we are we're in a unique and awful circumstance, and we gotta kind of work together to get through it. And there are going to be people who don't have any sick time who, are going to really suffer economic consequences if they're not paid for those days. So we want to make sure that trust fund stays there for them.
Rui writes that he appears to be, if he went back to the beginning of his unemployment time, he would be about $2,349 behind because he was not able to get through to the system in April. Is there any kind of retroactive reimbursement for someone who now this far out, here we are in December, ostensibly in December, and they are looking back and saying, wow, I couldn't get through at that point. I couldn't figure out the system. I never got my retroactive payment. Is that something that's possible to sort out at this point?
It is possible to sort that out at this point. And, he should definitely give the call center a call and work on that. It would depend on which date he gave. And I'd encourage people, with whatever they're telling folks when they're applying for TDI, UI, PUA, it doesn't matter. Just tell exactly what happened. When you went out, what day, when it was. Don't worry about what you think you should say. Tell the truth, and we will figure it out with you.
And last question that we'll get to here is from Kay, who asks about TDI. She says also retroactively there had been something in the system that for the last month and a half she should have been receiving, and when she finally got through to somebody, her claim hadn't been processed yet. Is there anything to that? Is that just a one-off situation? Do you have a batch of TDI cases, I guess, that something fell through the cracks in recent times?
I don't know of a batch. Again, like UI, each TDI instance is different. So, it may be that she fell through the cracks or that there was a complicating factor in her application. But typically, things are moving pretty quick.
Director, thanks so much for your time. Appreciate it. And here we go. The second wave. Let's. I think we've all learned from everybody is more prepared for it, and it certainly seems like on your end you've gotten. Not to, again, this isn't to rip the DLT from the perspective of March, because nobody was really expecting what we ended up with, but it seems like we're heading in a better direction for this second wave anyway. Well,
thanks for saying that. And for sure, nobody was prepared for what happened in March. If I were just talking to my DLT team, I would say that, we achieved a C+ or B- in the first part of the pandemic. But boy, oh boy, was there a curve for that grade. There are some states that people are still not getting the FEMA benefits. We can be frustrating. I know it's been hard for folks who've been relying on us, but we've been moving quicker than almost anyone else, and we'll continue to do that.
This is the Bartholomew Town Podcast.
Tune in this and every Thursday for Governor Raimondo's weekly COVID-19 address at btown.stream. You'll be able to watch live and interact with other viewers. I'll be there in the room asking questions. If you've got a question you'd like me to present, email me, bill@ripodcast.com.
At HealthSource RI for Employers, we provide access to health insurance to more than 1,100 local businesses and nonprofits, and 96% of them renew through us every year. Maybe it's our choice of 19 different health plans, our 10 years of customizing solutions, or our one local team of dedicated experts helping employers find quality health insurance. See how our numbers stack up for you. Learn more at healthsourceri.com/employers.